I am not in favor of healthcare reform. However, I am in favor of reforming the insurance industry. Number one, there are so many lobbyists in Washington, all these big bucks that are lobbying for all of this. Insurance company industry, not healthcare reform. And I have another comment about, the VA system you said works very well. Well, personally, my son's best friend was injured critically in Iraq. He is now a 26-year-old blind veteran, and I think the healthcare system sucks. When he got to the benefit, was unbelievable. I think our veterans deserve nothing but the best. And doesn't even want in this budget that they're giving to the Department of Defense, but it's because of certain congressmen or senators in their district giving this money to people there. Cut out the waste, but give our veterans the utmost care that can be given.
$190?
They're not coming forward.
190, what's another number?
124.
124?
211.
211.
261.
261. Is it warm in here? Go ahead, ma'am.
But I'm Karen from Pennsylvania.
Hi, Karen.
Hi. Okay. A couple things, though, that have been bothering me. You said that Medicare and Medicaid work beautifully.
I said efficiently.
Efficiently.
Yeah. Big difference between beautifully and efficiently.
Better word yet, because when my dad was sick and he needed a wheelchair, got a wheelchair, wasn't the right one. They came and got it. We got wheelchair number 2. My mom noticed after a couple of months that the government was being billed for these 2 wheelchairs. It took me weeks to get it straightened out through government bureaucracy. How is this going to, I mean, that's only one little thing, and this is a big issue, government takeover of our health system.
Right. And you bring up a very good point, because one of the things that is a concern is the inefficiencies using the kind of paper system we have now. And one of the things that the bill wants to do and seeks to do is to go to electronic record keeping, which is far more efficient, and looks at getting rid of simplicity of the system. So you don't get billed twice for the same thing. And by the way, when you get billed twice for the same thing, both those bills get paid. So, and that's 50% of the cost we don't have to pay coming out of all of our pockets. So building those efficiencies back in the system. Danielle, I think just to point you out, since you just spoke on behalf of the people who manage the policies every day. I think you would probably like to see electronic record keeping across the board.
The insurance companies do use electronic record keeping.
Right, but to work with the hospitals and to work with the
and they are. In 2003, the other part of HIPAA that was passed was the electronic keeping, the 835s and the 837s. So we're already on board. We need the government.
How far down the road are we with that? I mean, we need to go much further and get that.
We've got our system set, and I'm really not trying to be bold here, but we've got our system set up, and so do the other insurance companies. We need the government to come alongside of us now.
And that's what the government needs to do.
So you need to follow suit to us, not us following suit to the government. I think that's what we need to say.
Understood.
I have another question. This is not on health care. Today, I was listening to the news, and they talked about opening up the records from the interrogation of CIA. That really scared me, because you were in the military, you know.
I still am. Yeah.
You still are. And Obama told us, let bygones be bygones, let's look ahead. And we have Afghanistan, we have lots of problems out there. But the Attorney General has decided to pursue this and has hired a person that's going to prosecute. What do you think of this?
Well, first of all, I don't know all the details. I heard that as I was coming in today, so I want to find out what the details are. You know, I'm an intelligence officer myself, and I will tell you, I'm the only member of Congress that's actually interrogated prisoners in Gitmo. So that's maybe
They're still alive, ain't they?
maybe news to some of you, and they're still alive. Well, let me say, as an intelligence officer, information gained from torture is less trustworthy, actually, because at some point they think you want to hear to get the torture to stop. However, your point's well taken. Will that have a chilling effect on going forward on those interrogators and those officers? Look, we're a nation of laws. You know, we are a nation of laws, and we need to live up to those laws. Absolutely. You know, actually, the terrorists win when we start changing our rules to them. And a couple of times, hold on, a couple of times I swore an oath to protect and defend the Constitution. So, you know, we need to use that as the principal guide here.
Yes.
That said, we need to figure out what went wrong in the past so it's not repeated in the future. That's the key here.
Don't you think that will intimidate the CIA people of the future?
Well, I hope so. The CIA people? Probably not, actually. Okay? I think that the CIA, the DIA, the other organizations, there are 16 of them, will continue to do their work. They will continue to do exactly what they have been doing. What we want to do is, once again, make sure we live within the guidelines and live within the Constitution. Because when we don't, the bad guys...
But Obama went back on his promise. He did say...
That's right. You know, that's something that is hard for me to understand. Why, if he said let bygones be bygones, which he said, then...
He lies every day.
You're right.
He won't go for anything that's not going to cost us $1 million. Let's see.
Okay, we have our last three lined up here.
Hi, my name is Barb Gray, and I am for healthcare reform. Industry for many years, and I worked very, very hard, 80 hours a week. I had 3